Is a dry cough a symptom of COVID-19? SARS-CoV-2, which is the virus that causes COVID-19, is a respiratory illness that commonly causes a dry cough. A dry cough is a cough that does not produce mucus or phlegm from the airways. A person with a dry cough may experience a dry, scratchy, sore, or rough throat. There may also be a sensation of a tickle in the throat or a patch of the throat that feels dry, even when swallowing. There may not be any relief from a dry cough even after coughing. Is a dry cough a symptom of COVID-19? A dry cough is a common early symptom of COVID-19. According to some estimates, 60 to 70% of people who develop COVID-19 symptoms experience a dry cough as an initial symptom. However, several other conditions can cause a dry cough, including asthma, idiopathic pulmonary fibrosis, gastroesophageal reflux disease, upper respiratory infections, lung cancer. Related symptoms. A dry cough that is accompanied by other symptoms may indicate COVID-19 as the cause. These related symptoms include headaches, muscle or joint pain, a sore throat, a runny or congested nose, diarrhea, nausea or vomiting, shortness of breath or difficulty breathing. Self-reported symptoms include a loss of taste and smell, a loss of appetite, unexplained or unusual exhaustion, a high temperature. A 2020 study from Wuhan, China found that the majority of people with COVID-19 seemed to develop a dry cough one day after becoming ill, and that the cough lasted for roughly 19 days. The cough persisted for roughly 4 weeks in around 5% of people in the study. However, ongoing studies are finding that a cough is one of several symptoms that may continue after initial recovery from COVID-19. Symptoms in children and young adults. Children and young adults can experience COVID-19 symptoms, though they may be less likely to develop COVID-19. Some studies also suggest that children and young adults may be less likely to experience the common COVID-19 symptoms, including a cough, a fever, and shortness of breath. In addition, they typically experience less severe forms of the disease and its symptoms. However, an exception to this rule seems to be that infants under 1 year of age with underlying conditions may be more likely to develop severe COVID-19. Experts know much less about the prevalence or common presentation of a dry cough related to COVID-19 in children and young adults than with COVID-19 in adults. According to the study above, 54% of people under the age of 18 years experienced a cough as a symptom of COVID-19. Post-COVID symptoms. People who continue to experience symptoms after recovery may be experiencing post-COVID conditions. There are several of these conditions including long COVID, multi-organ effects of COVID-19, effects of COVID-19 treatment or hospitalization. Even a person who did not initially have severe COVID-19 symptoms may develop longer-term health issues, according to the Centers for Disease Control and Prevention. A cough is a common symptom of long COVID, alongside fatigue, dizziness, and joint pain. In fact, according to a study in the Lancet Respiratory Medicine, online surveys have found that 20 to 30% of people still experience a dry cough 2 to 3 months after becoming ill with COVID-19. An early study from Italy found that 16% of people who recovered from COVID-19 reported still experiencing a cough 2 months after being discharged from the hospital. More recent studies, such as the one in the Lancet Respiratory Medicine, have also found that a cough may continue for weeks to months after recovery from COVID-19. Some other symptoms associated with post-COVID conditions include exhaustion, nerve and joint pain, brain fog or confusion and memory problems, gastrointestinal problems, a loss of taste or smell. Prevention. To reduce the risk of having exposure to SARS-CoV-2 and transmitting it to other people, the CDC recommends in the following preventive measures. Wear a face mask when in public and among other people. Wash the hands thoroughly and frequently with soap and water or hand sanitizer. Stay 6 feet or 2 meters away from people who are not in one's household. Get a COVID-19 vaccine when it is available. Avoid poorly ventilated indoor areas and crowds.